Hi, my name is Jody, and today I will be going through a physical assessment for a postpartum patient for lab checkoff. I'm using the Bubble He acronym, and of course, before you start, you should have hand hygiene and make sure the patient's okay with you touching them. Explain what you're going to do through each step, and for a nurse, it's important to wear gloves during this exam because you may come in contact with bodily fluids. Okay, so the first letter or the first thing you're checking in your physical assessment is breasts and nipples. So when it comes to nipples, what you're looking for is if they're inverted, if they're everted, or if they're flat. When it comes to breasts, when you're looking at them, you're looking for bruising, redness. You want to make sure there's no streaks. And then when you palpate them, you're seeing if they're firm, soft, filling, with milk yet. What's the temperature like? Is it cool? Is it warm? You want to ask the patient if they are breastfeeding or if they've been bottle feeding. If they're breastfeeding and you do note some bruising, I would ask the patient if next time before she breastfeeds, if she can call me in so we can help alleviate the pain to lower the risk of bruising during breastfeeding. The next one is U, which is uterus. When it comes to the uterus, you're focusing on the fundus, which is at the top. So I have a pillow as my belly. If my belly button's here and the head of the patient's up here, you want to make sure you have one hand always under the uterus so it doesn't get pushed out when you're massaging and touching on the fundus. So when I'm touching on the fundus, I'll be using my hand to palpate the top. First, you want to note the height of the fundus. You start at the umbilicus, and you're either going up or down from the umbilicus, depending on where your fundus is. This indicates the height of the fundus. You also want to know where it lies, if it's midline or if it's deviated. Deviations can be caused by different things, like we'll talk about with if the bladder is distended, which can cause the fundus to be deviated. Also, when it comes to your uterus, you want to know if the fundus is firm or boggy. If the fundus is firm, this is what you're looking for. If the fundus is boggy, you're massaging it till it becomes firm, which is helping with the uterine contractions. The next thing you'll assess is the bladder. You want to know the last time they urinated and if last time they emptied, and if it was by catheter or if it was spontaneously, and the amount, color, smell. You want to make sure that you just check if you can palpate the bladder, and if you can, that means it can be distended, which means you probably should take your patient to the restroom as soon as possible, because it can also cause the deviation of the fundus. Next is other B, which is bowels and abdomen. So with bowels and abdomen, you're asking when their last bowel movement was. You want to know if they've been able to pass gas, if they're hungry. For bowels, you want to know if they have hemorrhoids, if you see any hemorrhoids, and you also want to make sure you listen to bowel sounds. For the next is lochia. This is the amount of blood that's present in the pad. So you'll be checking actually inside the pad for this part. You want to know amount, color, is there any clots, how many pads have they had to use since you've last been in there. Then the next letter is E, which is for episiotomy or incisions. For this one, it's not for all the patients, but it's for those that get an episiotomy or have an incision. And for this, you're going to use the acronym REDA to check it. So R stands for redness, E is edema or swelling, the other E is ecchymosis or bruising, D is for drainage or discharge, and A is for approximation. Approximation, you want to make sure the incision is closed and there's no gaps or openings. If there is, that's something you need to tell the doctor. For the other letters, right after giving birth, so in postpartum, a little redness and swelling is normal, but it's important to know. So if there's any changes, it's documented so you can see if it's gotten worse since the last time you've been in there. The next letter is H for Homans or you're checking their legs. You're checking for DVTs. Since you do have 2 legs, it's important for this part of the assessment, you're doing it to both legs. So when you're working down, you want to ask if there's any pain. You want to see the warmth, if there's any discoloration in the legs. You want to check for pedal pulses. Make sure you do it bilaterally. You're looking for circulation. You're looking for to make sure, especially if the patient's had a C-section, if they have sensation and they can feel, and they're able to have movement again. The next letter is E, which is for emotions and energy level and also bonding. So this is when you're kind of just observing your patient during birth and after birth. Your patient emotionally could be really excited. Maybe they didn't have the birth they were really expecting. Maybe it's not the gender they thought it was going to be, so their emotions can be a little all over the place. And giving birth is exhausting, so they're also their energy level. So you're seeing if they're able to ambulate, if they're ambulating just in the room, if they can ambulate down the hall. Also, if there's family there, you're looking for family interactions, like how are they reacting to other people that are in the room? Are they interacting with their baby? Are they showing bonding, reaching out, calling by name, pointing out features that look like their own? Just any interactions in like the taking in phase. And this will conclude your physical assessment. It's important to document everything you do. And if there's anything that's abnormal, of course, it's important to tell the healthcare provider, and to note it, make sure you wash your hands and you let the mama rest.